fistula affects women, yes, but it's not a women's issue, it's a human issue.
I am committed and advocate and prioritize maternal and newborn health through the Beyond Zero campaign.
Welcome back. I'm Cecilia Karanja, the founder of Fertility organization, and we're just talking about some of the fertility procedures available to men and women. So, what are some of the fertility procedures you can, when men and women come to Fertility Kenya, do you recommend, for instance, like IVF, for instance?
We don't really kind of tell them what they need to do or what not to do, but we give them the different types of treatment of infertility. But it's the doctor who decides what kind of treatment they need to undergo.
At the beginning of the show, you usually say that you're a Christian woman. Now, how do you now reconcile that aspect of Christianism and now IVF, like the scientific way of getting a kid? Because there are people who believe that if they can't conceive naturally, then that is what God has planned for them.
I've experienced that case in Fertility Kenya. I've had a couple who wanted to do IVF. No, they came here and I told them now this is the real thing. Now IVF is the solution, and now we need to do. Now you need to do IVF because the age is against you. Yeah, she's past 40 years, going to 50. So I told her, now we need to do IVF. Said, yeah, I think that's a very good thing, and she was so excited. Now she went to share at home. The parents and the sisters are Catholic, or they're Christians, and they were like, what? That is not godly, that is a curse, you're not supposed to do that. If you're not getting, you're not supposed to get, you need to just stay like that, wait until God gives you a baby. But for me, I have a different perspective. You who is talking about not having IVF, you have your 5 children. You as a sister who is telling your sister not to do IVF, you have another 3 kids. She doesn't have even 1. You don't know the pain she's going through. If God gave doctors the wisdom of doing IVF, why don't we do it? Yeah? It's the same thing as treatment for cancer, I would say, or treatment for HIV or anything else. You know, this is another treatment God has given us. And it's not that we are taking artificial egg. We are using her eggs. We are not taking artificial sperm. We are using God-given sperm. All what we are doing, we are helping in fertilization. Right now we are saying we are using her eggs to fertilize with the husband's sperm, and then we are going to put it back in her womb. It's not that we are creating. We are not creating. We are not God.
You're not cloning.
Yes, we are not cloning. It's the same thing. It's just that we are easing the process because it is not happening naturally. So what we are doing is, if you are not able to get naturally, we are helping you get in assisted reproduction. Yeah, we are just assisting. We are not creating. We are assisting the connection of the egg and the sperm. But in real sense, it's the same egg and it's the same sperm that God has given us. It is not artificial. So it is godly.
So at least nature needs sometimes a helping hand.
Yes, thank you. I like that. Yes, nature, needs a helping hand.
Okay, so since you founded Fertility Kenya,
Yeah.
what are some of the biggest challenges you've actually faced?
Well, challenges. Talk of challenges. So when I started Fertility Kenya, I had all these dreams, all these things that I would have to help these women. I remember the first time we had this meeting, I even cried in front of the beneficiaries, just trying to show them how much I'm so passionate, how much I'm even feeling them. So I knew and I thought that the journey would be so easy, that I will get donors to just support Fertility Kenya. Until that these women who are struggling with infertility, I'll be helping them like this and they get babies, you know. I even used my resources to even go and do studies, I remember I went to Dubai just to see if I'm able to get donors or people to support whatever we are doing. But unfortunately, we could not get. So basically, what I'm trying to say is, this being an initiative that is new in our country, people have not yet embraced. They think that infertility is a personal thing. So basically, it has been a challenge in that area of just getting the donors and everything. And then I think because people have really struggled with infertility, most of them have come to their ends. I have a member here who have stayed for 22 years without, I think that's the longest, 22 years without having a baby. So what does that person want? Yeah? Even if it's you, if I've stayed for 22 years, when I come to you and you're telling me you have a solution, what do you want? You want an instant magic miracle happening. They want me to give them like a solution there and then. They don't want stories. So basically we find a lot of challenges because we are unable to meet their needs. The reason being, as much as we are telling them they will get, and it's easy for them to get, they'll undergo the IVF, the treatment is very expensive. And even if we were to take them through adoption, there's also some fee to be met. And these people, for sure, even if they walked in here, there are people who don't have money. Even getting fare to just come to this office is a struggle. So they come here, you start telling them about money, they just go and go back to the same story of I've been cast or I have been bewitched, because it would be easier for them than now tell them look for 500,000 to do IVF. So that is one of the challenges that we are facing. People coming to us with a lot of expectations. With like, when I see Cecilia, I'll go home with a baby the same day.
One way of actually addressing the challenges Fertility Kenya face is by creating campaigns and more public awareness. That is, more people to know that infertility is a problem, but it also has a solution. So I understand Fertility Kenya also is planning to launch a campaign called 10 for 10 for Mother campaign. What is that campaign, and generally what do you hope to achieve with that campaign?
Okay, thank you very much. As I said earlier, we really have emphasized as people who are affected with infertility to just come out, and that is why we have these large numbers of people. We've gone around talking to people to just come out, and we tell them there is a solution. But now the challenge that we have, as I told you before, is now when these members come to us, we are not giving them a solution. When they come to us, we tell them you need to know the problem. Now they know the problem. Sasa nimejua shida yangu ndio hii, I need to do IVF. So IVF, how much does it cost? Almost $500,000, 350 to $500,000. A common mwananchi will not afford to do IVF. Adoption. If I wanted to do adoption, how much does it cost? It will cost around between 50 to 100,000 just to an adoption, because of the legal fees and all these things. So what we are saying, from the tests all the way to the solution, it's very expensive. And what we have realized, we as Fertility Kenya, we are not a shoulder to lean on until we give them a solution. So we have decided to do a campaign to raise money. we are calling it 10 for 10 for a Mother campaign. Why is it called 10 for 10 for a Mother campaign? We are saying we are looking for 10,000 people. Yeah, we've done a budget for the whole 300 members. It's coming to a total of like 100 million. So what we're doing, the month of November, we are going around looking for 10,000 people or 10,000 Kenyans to give us just 10,000 shillings to be able to raise 100 million so that all the 300 beneficiaries are able to undergo the treatment. So that come first week of January, they'll either undergo the adoption process, some will undergo the IVF, some will undergo IUI, yeah, some will undergo even surrogacy. So we have all the records with us here in our foundation. If anyone wanted to know the number of people who are going through the IVF, the number of people who are doing adoption, they will all get the records here. So basically, that is why we have that initiative, and we are asking our fellow Kenyans, people of goodwill, to just support this initiative. If you don't have 10,000, you can contribute as little as you can. In fact, we're saying as little as 10 shillings. But we want real Kenyans to understand what we go through when we cannot conceive. The divorce rate, the beatings, the stigma we go through when we cannot get these children. It's not easy for us. It's very painful. It's a very painful experience. For those people who are able to just conceive naturally, count yourself very lucky. Yeah? For those people who've never struggled with infertility, count yourself very lucky, and support this couple who's not able to conceive. In fact, we've extended our campaign further. We are saying, what are you giving this Christmas? Do it differently. Because we are used to going to children's home, we are used to going to giving to the old people. Now we are saying, do it differently. Support a couple, get a child. So we want the companies that give during Christmas to just do their CSR by supporting a couple to get a child by as little as 10,000 shillings. What is 10,000 shillings in a company? That is little money, but that is a lot of money to somebody who is ready and desperately needs a baby.
And speaking about supporting the campaign, now if somebody wants to support the campaign, is there like an M-Pesa number they can send them money to, or they need to come to your offices, for example, at Valero or something? How do they go about it?
Okay. Yes, we are really ready, and we have set aside an M-Pesa number for the contributions. Our M-Pesa number is 7622222. That is the pay bill number. I repeat again, 762222. Then the account name, you can write your name, because we'll be appreciating you. Yeah, we'll be writing SMS back just to thank you. And for those of you who will be contributing the 10,000 shillings, we'll be putting you on the newspaper, full page. We want to appreciate you by putting full page newspaper, just to say thank you for supporting us. Also, if you're doing your checks, you can do to Fertility Kenya. Our bank account is in Cooperative Bank, Parliament Branch. Yeah. Also, if you want to visit us, we are located in Valley Road. If you're taking a matatu, take a number 46, alight at the bridge of NPC. Just go straight up. You leave the first gate, the second gate. The second gate is AEA building. Just get in there, ask for Fertility Kenya. We are there from Monday till Friday, from 8 a.m. till 5 p.m. You can also reach me on 0722 774371. Again, 0722 774371.